Today is post-MST organized bodega day. So my bodega is actually inside my house, and so at the end of an MST, we sort of just drop everything off and then I organize afterwards. So as you can see here are big materials like our tables, our exam beds, our dividers, and then we come this way into the bodega. And this is what the bodega looks like at the end of an MST. So everything sort of just dropped off, and then because of the Ministry of Health standards, we have to organize it all on these shelves labeled by the type of medicine and by expiration date. So I will be spending all morning organizing all of this. This is what our bodega looks like, with all of the medicines categorized, organized by expiration date, all of the supply suitcases organized as neatly as possible. And yeah. Post MST, a big thing we have to do is referrals, and that, at least for me, actually requires a lot of work behind the computer and sort of on the phone before we're able to actually do them. Many of you that have worked with TimmyCare know our data comes back to us looking like this, which is not exactly the prettiest format for all of our referral data. So usually I spend a lot of time sorting through all of the referrals that are given to us in TimmyCare, cross-checking them against a handwritten list I try to keep during the brigade to make sure that nobody's missed, and that if sort of referrals are sent to the wrong place, I know where they're actually supposed to go. And the first thing I do is organize them all by referral sort of clinic or site first. And once I have the list of those, I send them off to the clinics themselves or the hospitals to ask for appointments. Once I hear back about all the appointment times, I make lists specifically for each TAPs that work at the health center that are in charge of each of the communities. So they each sort of have a list of patients that they're in charge of helping me communicate their referral times with, because not everybody has cell phones, and even if they do give us a number, a lot of times the numbers don't work at their own service. So a lot of our communication is done through the TAPs in person. So they get a list of their referral patients. They help me communicate with them so that hopefully they show up for their appointments. And then we also give a list of all of the follow-ups or people that are referring straight to the health center, so they know all the people we saw in the brigade and who hopefully is going to be showing up at the health center for more follow-up. So all of that actually takes a few days or even up to a week to sort of get all that information in check. And then we actually start doing the referrals, which we will start tomorrow in Sumbawa. Good morning. So we are here in Guangaje getting ready to do our first day of referrals. I left La Tacunga at 6 a.m. this morning to meet up with our driver, Don Alfonso. Hola, Don Alfonso. We're in Guangaje right now. We just picked up some of our patients that are coming to Sumbawa with us. In Sumbawa, there's a hospital that's actually found by an Italian organization. Well, it's private, but their mission is to provide as much affordable health care to the indigenous population of this area as possible, so they have really cheap consults and exams and all of that stuff. So we are on our way to meet some more patients there to do a bunch of exams today, like x-rays and EKGs and stuff like that. So we are on the road. We've got plenty of bread to keep us satisfied for the next couple hours, and we're off. So now, just about 2 hours after leaving La Tacunga, we are pulling into the town of Sumbawa, where we are heading to the hospital. And luckily we get to enjoy the most beautiful views while we're out here. So even though Sumbawa is much farther from La Tacunga, it's closer to Guangaje, and the attention they have here at the hospital is much more focused towards the indigenous population that lives here.